and welcome to another edition of the Scenic View podcast. I'm Jonathan Owens, your communications director here at Scenic. I have Ardis Watkins, our executive director, in here today, as well as Sam Cline, our podcast producer. Suzanne's not with us this week, Suzanne Beasley. She's had a pretty busy week, and Ardis, you actually got involved a little bit in the lobbying this week as well.
Yeah, before we get into that, Suzanne, I hope you get well. I do have to say, Suzanne is laid out with, I'm going to tell all your business, Suzanne, since you're not here. Doesn't appear to be COVID, but she sounds awful.
So I saw a story last night that people are getting influenza A and then getting B at the same time.
It's like head... Yeah. That's respiratory nastiness. So
it's not the bird flu, is it?
No, I don't know.
I've been washing my hands every single second.
If I did know, I would tell it, apparently, despite her not being here to defend herself. But my point in saying all of this is, Suzanne, get better. But also, Suzanne is bad to the bone because yesterday, as she's laid up and sounding the way she sounded, we were calling different legislators about a bill. And first of all, I want to tell you, some of those legislators she talked to were so sweet.
Oh.
And also kind of gave medical advice, not medical advice as in illegal medical advice, but, like in a nice way, like your friends would give you tips on, hey, you might try this, that, or the other. Very, very sweet. And the legislature really is a family at the end of the day, even though we all scrap sometimes. It's a family. We all care about each other. We don't want to see bad things happen. So she had that good experience of people being so nice. But then a funny one, another one of our lobbyists, Flint Benson, was told by a lawmaker, one of your colleagues called me today and she sounds like she has pneumonia.
So I was going to ask that, is that a thing over there? Because you guys are kind of all in the same building walking around. Is it common for colds to start circulating? Or
oh, yeah.
Really?
I mean,
kind of like a school, huh?
Yes, because if you're sitting in committee, you're sitting really close to other people. But mainly, people get concerned. If somebody's not there, it is weird. It's like this immediate concern is so-and-so okay? So get better, Suzanne. And thank you to the lawmakers who had concern about Suzanne this week.
So I've listened back to a few of our episodes and I realized I need to slow down at the beginning and kind of set the scene a little better. So today is February 6th. It's a Thursday, if that helps you any. And finding out where we are in the world, that's, I guess, what is this, the second week of the legislature?
Well, it's the first full week.
Yeah.
Yeah, because Suzanne said last week was skeletal sessions.
Yeah, things are cooking though.
Yeah, and we've seen some bills be filed. I know you said you've made some maybe headway on the whole health plan situation going on, or you've been able to educate a few folks.
I think that what's happening is, and this isn't necessarily related to the state health plan, but we've done a lot of discussion on this podcast of how North Carolina's number one in the country in terms of cost. It's the most expensive state in this nation to buy health care. And as Senator Bergen pointed out in committee yesterday, to be the most expensive state in this nation for health care is to be the most expensive place in the world for health care.
Yeah.
Because this nation's more expensive than the rest of the world.
Just think about that with huge
we've got wonderful facilities.
In other states, you would think that.
No, I meant in America, we've got wonderful facilities. We've got wonderful facilities here in North Carolina. We have a lot of access to health care. But again, we are number one in cost. And we are near the bottom, 3 from the bottom in outcomes, meaning how well the patients do when they go to get that care. So those seem to be connected. And one interesting thing, Senator Bergen, the chair of the Health Committee in the Senate, and as he noted yesterday, the state of Massachusetts is at the bottom in terms of cost. So they're the least expensive, but their outcomes are the best.
Wow.
So, the question was being bandied about yesterday. Why is that? And we looked at it because, of course, our big beef with healthcare in North Carolina, and it really impacts our state employees, is that the state health plan is 10% of the market, and we, by law, cannot have access to what we're paying. These are secret contracts, which, by the way, many members of the legislature yesterday had no idea because, no one would know. If you're not over there trying to get these contracts from the health plan, you don't have reason to know. But that was interesting to me. It's, if anybody's interested at home, it's North Carolina General Statute 135-48.10, and it's the legislation regarding the state health plan. It says that medical records of patients in the health plan will be kept confidential, but also vendor contracts.
Yeah, you think about Massachusetts, you always think everything is more expensive there, you know?
Right, but their health care is way more affordable.
Yeah.
Well, in an interesting twist, we were curious. Okay, we can't get access to anything. Everything is kept secret on behalf of the industry here. Let's check Massachusetts out. In Massachusetts, in 2021, they passed a law saying if you go to a provider, they have to tell you how much it's going to cost under your insurance plan. And if they don't, they get fined $2,500 per incident where they didn't do it.
I like that.
Right. But also, you have to wonder. And by the way, that was passed in 2021, went into effect January 1, 2025. So I think they gave the industry a very long time to have to get ready to share what they're charging. You have to think that kind of commitment and seriousness about it has gone well for them because they've got affordable health care. Not affordable, but more affordable.
Yeah.
Do we know if before this was passed, they were still the most affordable with the highest quality, or if it changed after this law
2021 when it was passed? I don't know. I hadn't gone back and looked at Forbes that always does these rankings of states with regard to their health care. And there's 3 things they look at: cost, accessibility, how many places you have to go to get care, and then the outcomes. How well do people do with the care once they get it? So every year they put that out. I haven't gone back to look before 2021, but obviously there's been a commitment for a while in Massachusetts to saying the public has a real interest in knowing what they're paying.
Yeah, so we were asked a couple weeks ago in one of the interviews we were doing if other states have a reference-based pricing model. That's kind of what we were pushing for. And it was funny because that afternoon I received a Google alert that's a story exactly on that issue. And it says that Washington State, Oregon, Montana, and South Carolina all have initiatives in the works or actual legislation about reference-based pricing for their state employee health plans. Is this something that we would see here? Or
No, we're not going to see it here. You'd have to have support from the treasurer's office to see it here. And the treasurer's office is really silent on that. In fact, yesterday, Senator Bergen and some others had a bill in committee saying, look, the cost is too high in this state for healthcare. We've got to do something about it. It's killing small employers. We know it's killing the health plan. All of that's true. And he and some other legislators put forth a bill that said what we're going to do is there can't be any new health mandates for coverage for insurance companies to have to cover these things. If there's a new mandate that's thrown out there on insurance companies through employers, then that mandate has to go on the health plan and the legislature has to appropriate the money to support that mandate. Well, obviously, they're not throwing money at the health plan right now. They're talking about trying to get the employees to pay more. So that means no more mandates on coverage. And what does that mean to the average person? It means you may have a condition that if it was mandated that they cover it, in essence, it would be so costly that it wouldn't happen. So I don't see how, and I said it in committee, I think their intentions are right. They want to bring healthcare costs down. But we maintain and said in committee, with the state health plan being 10% of the market, the way you bring the cost down is you make it transparent and open what we're paying, because if you can rip off the state health plan, you can rip off everybody else. We know we're paying too much. We're number one in paying too much. Like, this is our distinction. And it's not the first year we've held the title of number one in terms of paying too much. So
it's not a title you want to hold.
Yeah, I mean, mandates don't appear to be killing the health insurance industry. And how would we know? Because we don't know how much those mandates actually cost them to fulfill giving treatment for. So the problem with that is we don't want to see feel-good legislation that actually doesn't change anything. Again, I think it was well-intentioned by Senator Bergen and everybody else that was involved. I don't think one of them had the wrong intention. But we asked, if you want to do something with this bill that we think would really make a difference, add a section saying that the state health plan costs would have to be public.
So our audience is obviously our members and the state employees. I mean, I hope other folks are listening. And I know the answer to this, but I'll ask you first. Why does that matter to a specific state employee?
Okay, so if you, right now, all we're hearing in terms of what to do with a $500 million shortfall, a hole, the health plan's in the red for $500 billion by fall of 2026. And where do you think so far politicians are talking about getting that from? And to be specific, the state treasurer, because that's the politician that matters in this scenario. You, the folks in the plan, you're always the place they want to go to get it because you're the low-hanging fruit. You're easy. You don't have the political clout to fight back in the way that big insurance companies and other corporate interests do. You have very little voice in this scenario, and that's why Scenic's here, to be your voice in this scenario. So if you can't get those prices made public and things stay out of reach and people say, politicians continue to say, we can't afford this health plan. Well, you can't afford it not because state employees are a sickly, awful bunch. You can't afford it because we're getting ripped off and nobody has to show us they're not ripping us off. And yet we know we're number one most expensive in the country. So this seems like a no-brainer.
Yeah, so our contention, and if we could see what the prices are, bring sunshine to them, then people, hopefully those prices would go down, which would cost the plan.
Well, it would certainly make it harder. We know some people are charging more than 3 times what it takes to make a profit and run a hospital. Now, we don't know who they are and how many of them are charging it, but we know from the consultants that work with the health plan, there are some charging us and therefore charging state employees 3.5 times what it takes to make a profit, a comfortable profit. So knowing that means it's that offensive that people would come to you and say, oh, what's another $25-$30 for a state employee per month? What is it? It's gas. It's food. It's diapers. It's anything that's important. And why would we pay 3 times for anything? Why would the government pay 3 times for anything and not demand to know who are we paying this to and why?
Do you think that the reliability of the plan as a customer, I guess what I'm trying to say is like they know they're going to get their money from the state health plan, so they charge what they...
Oh, heck yeah. I mean, historically, that's how the rest of the market in North Carolina has been subsidized.
Yeah, that's what I'm
overcharging the health plan. And I'm not talking about anybody necessarily that's a player in it now. I'm saying historically, it was talked about all over the legislature that that's exactly what was happening. And this is going back decades.
Well, obviously, it's an issue we'll keep working. It's probably going to be...
Yeah, but at least it's being talked about.
Yeah.
You know what I mean? Like, again, we'd love to see the bill change as it moves through the process, but at least Senator Bergen has put a bill out there and said, it's not good to be number one most costly. We're going to try to do some things about it. So kudos to Senator Bergen. We really hope to work with him on this. And we hope there's other legislators that'll say, we're tired of it. And we're seeing so much of this, as we've said before, on the federal level.
Yeah.
Hey, we're not going to pay these crazy amounts for some of the things the government's been doing. That's all we're asking here.
Well, a constant question we always have is any movement on pay raises? What's going on with the budget? What are you hearing?
Yeah, no word yet, although every legislator that said anything about spending is being very clear that they would like to save a lot more. Mm-hmm. And obviously that they would like to spend a tremendous amount on Western North Carolina, on the rebuild and on putting people's lives back together and businesses back together. So between that, as we've said before, and the revenue that will not be coming in as a result of the storm, it's going to be very difficult. In fact, Governor Stein has recommended an amount to send to Western North Carolina that's even bigger than what the legislature's been bandying about this week. And so we are looking at, obviously a lot of money, a lot of needs out in Western North Carolina. How that affects pay raises, we're going to find out. And by the way, speaking of Governor Stein, the governor's budget usually comes out in a long session in February. So we've been in contact with this office to ask about, making sure we are having those discussions about everything that affects state employees in the budget.
Man, that really just throws him right into the fire, huh? Like he's had less than a month to put that together. You think some work has been ongoing with the last administration, or? Well,
and I think that's one of the areas where keeping Kristen Walker as the director of the budget, OSBM director, was probably a really helpful move for Josh Stein because she's done this multiple times under Governor Cooper, so she's going to know what she's doing.
Do you think that the House not having a veto-proof majority will give them a little more power in the budget process?
Potentially, you still have what used to be known as the Main Street Democrats. There's 4 Democrats that people just aren't sure where they'll come down on budget issues, and we're still in that uncertain phase. It could help him. The raw numbers help him, but is the technical majority a functional majority? We'll see.
Okay. Well, sounds like a fun, what do you think, 6-7 months ahead?
Well, actually, let me rephrase that. Is the technical supermajority or technical majority going to actually be a functional supermajority? I finally got it right. It only took 3 times.
Yeah, we know what you mean, I think. No, but yeah, I think from the moment we heard that there's no longer a supermajority, I think you were kind of questioning that. I mean, a little skeptical.
You never know.
Yeah.
I mean, you just don't know over there, and we'll see. I feel sure that both Governor Stein and Senator Berger and Speaker Hall are all staying in close contact with folks that could make the difference in that vote.
Well, another issue that is a constant for us and not going away anytime soon is the issues at our prisons and our, the safety of our correctional officers, especially with the whole vacancy crisis. We were fortunate enough to get First Vice President Wendell Powell and Deborah Harney in charge of our Prison Reform Safety Committee together for a little interview we recorded a few weeks ago, and we're going to play it right now, and I hope you can take something from it. We're joined today by First Vice President Wendell Powell and the Scenic Prison Reform Committee Chairperson Deborah Harney. We want to talk a little bit about what's going on in our prisons, and Ardis, you take it away.
Well, there's been so much attention for years, for good reason, to what's happening with the safety of everyone inside our prisons because of understaffing. And that was way before COVID. Obviously, everything after COVID in state government became an understaffing problem. But the vacancies were high in prisons prior to that. And the 2 individuals we have with us have been in a huge part of the effort to educate folks about what's happening and to make it better. And so I would love to hear from y'all right now. Recently, there was the stabbing of a captain at Bertie, and that was not shocking to anyone out that way. Scenic have been hearing from folks at Bertie for quite some time, and this issue's not going away anytime soon. But Scenic is continuing to make efforts to not only bring awareness to it, but to suggest some kind of solutions. So if y'all can enlighten us, I know both of you have been deeply involved in the work, so...
Well, it's definitely unfortunate that a captain got stabbed, but if you look at the understaffing patterns, you have white shirts, which are the captains and lieutenants. We're on the floor. As a captain myself, I'm on the floor at my facility. Sometimes my lieutenants have to take a post. So we're out there searching, we're feeding, we're bringing in vehicles, we're doing trucks, we're doing everything that normal officers and sergeants would be doing. So we're right there in the fray. If we have to pull offenders out of the cell for a cell extraction, sometimes we're assisting based on shortness of staff. So we are in harm's way more than what we would have been 5 or 10 years ago because we had more staff.
So obviously, a lot of problems that we're facing in the state government, understaffing is the big issue, correct?
Yes.
It's just that it can be deadly in your situation.
Yeah. I mean, that captain was stabbed with a broken broom handle. So, I mean, even at my prison, we find shanks all the time. We find improvised weapons. I mean, they make weapons out of anything. And we've had a few assaults. So all it takes is the wrong time in the wrong situation. And there you go.
So, Wendell, you've been on the podcast once before talking about the issue in prisons. And by the way, Wendell Powell is our first vice president of Scenic, in addition to being someone very deeply involved in this move to make things better in prisons by working cooperatively and from an education standpoint with the departments, because sometimes people don't want to tell department leaders everything that's going on. That's where Scenic can play a role. People sometimes are afraid that they'll look like complainers if they kind of tell everything that's going on.
I think people don't want to ruffle the feathers. It's already a sore spot. And unfortunately, it's a spot that doesn't go away. And when you have leadership trying to do their best to manage the situation and work from their end, and then we're working from our end, sometimes they don't like it thrown back in their face. So they don't like to hear about some of the issues, even though they know exist. It's like a constant reminder. So sometimes it just leaves a sore spot with them.
Well, tell us about some of the work you've done. I know that the work hasn't just been in state. There's been a lot of outreach and work with folks in prisons in other states because this is a problem nationwide.
Yeah. Recently, this past November, I met with One Voice in Winston-Salem. We had a forum with formerly incarcerated and law enforcement from across the country as to ways of making jails and prisons safer, how to create better relationships between officers and offenders, and just how we can revamp the system to make it better for both sides, because the staffing does affect the offender safety. And also, at the same token, we have to have better relationships, because at the end of the day, those offenders are someone's mother, someone's brother, someone's cousins, uncles. They're getting out. And one day they need to have better recidivism. They need to have better ways of communication, better ways of moving through the system. And right now, our system is archaic. All the systems across the United States are archaic, so they have to be revamped and looked at how to treat people better and not violate their rights.
I must say that North Carolina Department of Adult Correction is a little bit ahead of the game as far as that is concerned. They're heavily into the reentry. Last year, I partnered with and brought Scenic and Prison Reform Committee with a group in Secure that was good partnership, I think, and the department partnered with them also. And they were like-minded companies, agencies that enlightened the department that reentry is the way to go.
So otherwise, it's a perpetual...
Right. It's a cycle.
Yeah.
And Deborah, you did a great job, because the DAC leadership was very happy about how it turned out, and they were very engaged in how it went.
Yeah. So that is my hope, that hopefully with my committee and with One Voice to North Carolina, and have them look at it the same way as when we partner with NCCare.
Yeah. That's something that I talked to One Voice about, and that's something that we're working on, doing a conference here and to bring awareness and to get resources and to get some of our people on board, the DAC leadership and the community on board, with just looking at corrections differently and how we can get better sponsorships and create better partnerships with the community so they can shed the light on how correctional staff work and how offenders are being treated.
So, Sergeant Harney, the work that your committee started after the murders at Bertie and Pasquotank, I think it was 8 years ago now, the work you started ended up in some pretty meaningful legislative reforms that had not been in place at that time. And Suzanne, what do you think about current legislators? Do they know about the challenges people who are working in the system are facing right now? What do you think needs to be done?
So obviously we will lobby that. As far as the GR team goes, the government relations team goes on the ground. But I think One Voice coming to North Carolina, that's huge for legislators to hear, like you were talking about offenders and employees of the prison system, correctional officers, and the safety. I'm not sure that legislators understand that to the level that they did after the attacks at Bertie and Pasquotank. You know, we had Senator Steinberg in office at that time, who became a real champion for prisons. He visited every prison in North Carolina. He listened to people. Senator Danny Britt, and Senator Warren Daniel are chairs of that JPS committee this year, and they're friendly to the plight. They understand. They're not new to what we've been working on. So I think we've got good people in place to work with going forward.
Well, we were very lucky that the incident with the captain at Bertie recently didn't end up being a fatality. But the concern we have for our members working in prisons is that there's so much still going on. It feels like a matter of time before, unless something more drastic happens. And do y'all feel like that's an overreaction, or is that closer to the mark?
I mean, it's pretty much spot on. You know, unfortunately, we don't have the luxury of saying if, it's just when. We're lucky a lot of days.
I agree. It's when.
And I think the public has no idea that at some of these prisons where we talk to people who work there, they say, look, the offenders are telling us you're going home because we're letting you, because the staffing ratio is so bad that there's just no question that it really is a matter of whether or not the offenders are going to put up a fight, as it were, and give more grief to the folks who work there.
And I think the offenders understand the system way better than what people give them credit for. They know the staffing patterns. They know when we have a lot of staff, and they know when we're very short, because they'll come and say, hey, can we do this? Because I know we're short. Are you going to let us do this? Because I know we're short.
Yeah.
Now there's the shortage rate. It's affecting the offender. They can't do the daily things that they would like to do, so that's the part that's when it gets to the point where we cut off everything. They can't go to the canteen. They can't.
That doesn't help morale.
Then that's when it's going to become a problem.
Well, and that comes back to y'all.
Yes, then it puts us in danger.
That's right.
And at that point, you're kind of opening the state up to even more lawsuits and things, right?
Mm-hmm.
So,
well, we were hoping the new Secretary Dismukes, we want her to know if she hears this, she's more than welcome to come on the podcast. Hopefully we can have her on soon. And in the meantime, I'm so glad y'all are here as a resource.
Always, we're here to help the department and reach out to the community to gain resources. As an organization, we're here to help the state and, protect our members. And if doing so, we can help others, then that's what we'll do.
all right. Well, thanks for joining us and keep on doing what you're doing.
Thank you.
Thank you. Okay, that was a great interview with Wendell and Deborah, if I do say so myself.
I love to hear them. Well, I don't love to hear them talk about prisons in that it can be really depressing and concerning, but it's always interesting.
It is always interesting, and I admire Wendell's kind of courage to speak up. He will tell you the truth about what's going on at the prisons, and he's very open about it. And let's end with a question of the week. I actually have a question of the week this week for you guys.
John's wacky weird question of the week.
Okay, it's pretty easy, right down the middle question for you guys. Who do you think's going to win the Super Bowl, or who are you pulling for? Do you want me to go first?
Sure.
I'm pulling for the Eagles just because Jalen Hurts was my fantasy football quarterback. And I'd like to see Saquon Barkley get a Super Bowl after how he was treated by the Giants. And he's just amazing runner. Not that I hate the Chiefs or anything. Don't come at me, Sam. But, it's time to see a new winner. So that's my take. Go Birds.
I think we all know I'm a Swiftie. Definitely went over to Chiefs Kingdom whenever Taylor and Travis started dating. But I'm also pulling for them because I'd like to see them make history and be the first team ever to do a three-peat.
Yeah.
I like the idea of just seeing them make history.
Let me ask you something. If Taylor's boyfriend transferred to another team,
I'd follow.
So your allegiance...
I'm a Swiftie. My allegiance is to Taylor.
Okay, but what if she breaks up?
Yeah, what if they didn't break up?
Then I'd stop watching football.
Oh, okay. Have you seen that TikTok where it's like a little girl? She's like 1 or 2, and she's like, her mom's like, "Who's your favorite football player?" And she's like, "Taylor Swift."
Yes.
That's how I think half the country is.
No, I would turn back into who I was before they started dating and just not watch football except for the Super Bowl. This year, I actually watched a couple Chiefs games. When we were at convention, there was one evening where we didn't have an event or anything. I was in there watching the Chiefs game.
Yeah, I don't know if I should even ask you. I know you don't really like either one of them.
I mean, I've been bitter since the 90s. But
you're not a Texas fan.
Well, no. Was a Houston Oiler for a long time. Most people listening to this wouldn't even know what the heck is that because they turned into the Tennessee Titans. They left Houston.
I lived there for 10 years and I didn't
Later,
know that.
Houston got a new team, the Texans. But I've never gotten into that. But what I do like is tight ends. Yeah. And so Taylor's boyfriend, obviously, Travis Kelce being one of them. And Dallas, is it Goddard?
I like him.
On the Eagles. I like a tight end. Because
put that up.
Yeah, because
should we just have that as an intro clip before we even start the episode?
Obviously a tight end's not going to go out and run some sort of really long route or something. I love that they go, what? But how long does a tight end go? 8-9 yards out in the flat, just boom.
Turn around
and just power through people. And I think that it's so much fun to watch them. They're tall and
handsome.
Okay. It's in the beauty pageant. We're talking. I just think the height, the hands, and the power, that's an interesting position. To me, that's always the most versatile position on the team. And this game, whether, I'm not a particular fan of either one. I think it's going to be fun, though, because when you have two really good tight ends, to me, the game is better.
Yeah.
Because it gives the quarterbacks more options.
And
this is going to be interesting.
I mean, this
Kelsey
is
really-
also
Go ahead.
this is also possibly redemption for the Philadelphia Eagles because 2 years ago they played the Chiefs.
Yeah.
Yeah, they don't have a Kelsey on their team this year, though. So Jason's
Yeah.
not playing for them.
Mama Kelsey is still wearing her
Is she
duo
still
jacket.
gonna-
She has her
Oh,
red
okay.
and green jacket. So even though
I saw they asked Jason's wife who she's
Kylie.
pulling for, and she said definitely the Eagles, right?
but she said that she loves the Eagles, but she's always pulling for Travis. So she'll be pulling for the Eagles, but she's also pulling for Travis
Well,
as an individual.
And Jason played another position for which I have so much respect, center,
Mhm.
because I understand that's
Yeah.
literally one of the hardest positions because you just have to have so much brute force, but you have to be so smart to be a good center.
I love your in-depth knowledge of football that I never knew
I'm from
about.
Texas, honey.
I never
You have
knew
to-
about
It's like
for 13 years until
They-
this podcast.
they may or may not. Like
I don't have
we
that
could have shared
knowledge.
so much in the last.
we could share a lot. Although you know what I have to say about North Carolina.
What's that?
I came to North Carolina and came in middle school, but went all the way through middle and high school, not going to one basketball game at my schools. I get to Carolina, people are just walking around the football games like, who cares? And I'm thinking, y'all, we need to
fun.
participate. The crowd is important. No one cared. But when basketball season came, they said, we have to go camp out. And
Yeah.
I said, camp out where?
to get your tickets.
Yeah, to get tickets. And I thought, I don't even understand the game. Everyone was horrified. But
Eh.
instead of shunning me,
They taught
the
you.
Carolina crowd taught. And now I am more obsessive about the rules of basketball than I ever was about football. I think it so much has to do with where you live.
Yeah. And,
That could be a good question. What's your favorite sport that you follow?
yeah.
All of them. Best sport ever, curling.
Oh, Carolina's cool.
When they
I'm a
have the
hockey
Olympics,
fan. My
Ho-
dad thinks it's crazy because
hockey's
he's
not
like,
as exciting as curling.
it is when they start throwing punches at each other.
You could,
Hockey.
they could add that.
I've found that hockey is awesome to watch in person.
Oh my
and
gosh,
like
I love it.
terrible to watch on TV.
Oh, yeah,
That's
it's
just
so
my
much on TV.
opinion.
But there's also not as many streaming platforms that stream it in high quality, which is why you're sitting there and you're like, why am I watching this? But you go to an in-person game.
Oh, they're fun.
Yeah.
And rugby, I've started watching rugby.
Oh, wow.
Is it because
Didn't
of Alona?
understand anything about rugby, but y'all, it's interesting.
I think lacrosse is pretty cool too.
Do you know who
Rugby
Alona is?
Who?
Alona Mar?
No.
Oh,
She was on the women's Olympic rugby team. She was also on Dancing with the Stars. She is amazing.
The nuggets of information that I get during these podcasts.
Yeah. She's making you younger.
No, I wish. No, I haven't seen. And you know what? I need to add that to my repertoire. I think that might be harder to find on television
Probably.
because men's rugby is hard enough to find.
Yeah.
But
I-
she just
I
started
shall
playing
look.
for a team in London. She got picked up by a team in London.
And she's been on Dancing with the Stars.
She was just on this past season of Dancing with the Stars, the same season that Steven Nadarazic was on.
Well, okay, a gymnast, I would expect Dancing with the Stars that they would be
Yeah.
extraordinarily graceful. Rugby?
She
They're-
also
they're just
blew
pure
up.
power.
She blew up on TikTok while she was at the Olympics because she was kind of just making funny little videos around the Olympic Village. And then the women's team won bronze. The U.S. women's team won bronze in the Olympics. And they brought her onto Dancing with the Stars along with Steven Nadarazic. And
I can't wait
she
for
was
the next
just
Olympics.
she was such a great time. She was so much fun. She is very muscular. She is very strong.
Rugby. I mean,
And she loved her experience there because she got to tap into that feminine side of her that she was just like, no one ever sees me as feminine.
oh, how awesome.
Because-
That's neat. I'll have to look her up. And water polo. Well,
She's so much
the
fun.
last Olympic sport I'm going to throw out. But y'all, water polo. That is so exciting. And the cardio. Anyway,
Yeah.
we'll have to do a whole Olympics podcast.
Can we?
So the Olympics are in LA in 2028?
Yes.
There's that.
Maybe we could do
Can
the
we go?
podcast. Yeah, live from.
So that was a sports talk for the Scenic View
That was
podcast.
a lot, wasn't it?
Thanks for joining us this week.
Go
and,
Super Bowl.
Go Taylors. No, don't go Taylors.
I'll say it. Go Taylor's boyfriend. Let's go.
All right. Thank you.